Here's a question on MACRA. Are providers other than physicians going to be reimbursed under MACRA? Can one more distinction be made between AMP and MIPS?
The way that I think about MIPS, and again, this is a simplification, this is what people have to do that are in the majority of the healthcare system. So for people like me that work for a university system, people that work for an HMO, people that work for a private physician group, the MIPS program, the Merit-Based Incentive Program, is what we have to comply with. In other words, there are rules. We have to select a number of metrics that we have to collect and report, and then that goes into that formula I talked about, and that's going to affect what our entity is going to collect. And the APM model, those are things like accountable care organizations, where you get a physician group and says what we're going to do is we're going to work and we're going to identify a community. An accountable care organization defines a community. So that could be like all the patients that come to the University of New Mexico. And in that community, there's, I don't know, 200,000 patients or whatever that we're caring for. We will establish a flat rate, after negotiation with the government, that we will care for all the patients with diabetics at a flat rate per number. And whether that patient is seen once, 0 times, or 100 times a year, we're going to get reimbursed the same. And it's sort of like what they did in the 1970s with HMOs. It was the same kind of payment system where you would basically contract to care for a population, and they would pay you a flat rate to care for that population. And the idea is if you can increase the efficiency of your organization to drive down the costs, you get to keep the difference between what you actually pay for health care and what the government pays you. That's a simplification. So the APM is a special kind of organization, and then the government doesn't require individual physicians to submit quality information like they do with MIPS. The organization does that as a group. The vast majority of people are going to be in the MIPS program.
Great, thank you.